Hi, my name's Andrew Briggs. I'm a physiotherapist and a professor of musculoskeletal health services. And I've been asked to talk to you today about thinking of engaging in physical activity during the COVID-19 pandemic, where you might start and what you might do if you get injured. During the self-isolation period and in the context of social distancing, many people might be experiencing an impact of low mood, feeling lethargic, or generally feeling achy from less opportunity to engage in their active or regular physical activity programs. For some people, this might mean less opportunity catching public transport, walking to the train, picking up children, or just going for general walks. For some people, our current social circumstances might provide the opportunity to start something new or make a positive lifestyle change that could incorporate physical activity, like a New Year's resolution. Physical activity and exercise is so important for both musculoskeletal health and mental health. It's great for joint mobility, muscle strength, bone health, balance and movement control, glucose metabolism, circulation, and mental well-being. For people with persistent musculoskeletal pain, for example, from osteoarthritis, back pain, or inflammatory arthritis, graduated movement and really careful loading of your musculoskeletal system can be a highly effective approach to managing pain. So physical activity is really important, perhaps now more so than ever. For some people, this might mean business as usual. You might be able to still engage in your normal walk, run, or home program. For some people, it might mean modifying an existing program or habit. You can no longer currently attend the gym, so what might you do? For some people, it might mean starting from scratch. And for these people, there are lots of online programs for people with existing musculoskeletal conditions, such as osteoporosis, back pain, osteoarthritis. And seeing a health professional for advice might be really important to guide you in how to start and how to progress. So what about injury or exacerbation of your current symptoms? Many people are fearful about this, and a common question we get is, where do I start, or what happens if I get injured? People who are well accustomed to engaging in physical activity probably know what to do and what works for them. For people who are less experienced or may need guidance from their health professional, this could be achieved, for example, through telehealth consultations or through looking at the rich information offered by many organisations such as Musculoskeletal Australia. So what are the general parameters to look for in an exercise program? Generally, we look for movement of your musculoskeletal structures, so moving your joints, stretching your muscles, some kind of aerobic load, meaning elevating your heart rate and feeling a little bit out of breath. And finally, muscle strengthening. So how do you manage musculoskeletal injury, such as strains, sprains of soft tissues? The first thing to note is that pain is normal, and in fact, it's a good thing. It means your body's warning system is working. Not experiencing pain is a problem. So don't fear pain or discomfort. It's just your body's way of telling you that something isn't quite right and you need to modify what you're doing. Swelling and bruising might also be present, and these are really normal and indicate the start of a normal healing process. So what can you do? Keep positive. Your body generally knows what to do, and it just takes time. Discomfort can be managed with reducing load, so that might mean pacing your activity, taking rest breaks, but complete immobilization or bed rest is generally not advisable for minor or moderate injury. Gentle movement promotes healing, and a little bit of soreness that's transient and associated with movement is okay, and this will ease. Sometimes elevation and ice can be really helpful for swollen joints, although there is some debate about the pros and cons of icing as it may delay healing. Medications such as simple analgesia or non-steroidal anti-inflammatories can also be helpful, but for many people, discussing this with your pharmacist or health professional is probably advisable. If you're worried or have severe or unusual symptoms, then you should speak to your health professional. And in the current climate, telehealth is a really effective way of doing that. Finally, if you have any queries or concerns, consider phoning the Musculoskeletal Australia helpline on 1800 263 265. Thanks a lot.